to another episode of the podcast Nobody Told Us This. I'm Dr. Liz, and today I am sat with a special guest, Sophie Garrad, who is going to be sharing her journey of endometriosis. Sophie is a brilliant comedian and an incredible endo warrior. Sophie says it how it is, which is what we're all about on this podcast. So, hi Sophie, thank you for being here.
Thank you for having me. What a treat.
Before we dive in, I always like to start my podcast with some quick fire questions, bit of an icebreaker to get to know you. So, introvert or extrovert?
I would say I'm an introverted extrovert.
Yeah, same. I was going to say, as a comedian, you have to have some kind of extroverted behaviors in there.
Yeah, I think people would say I'm an extrovert because I'm very, obviously, I like to be the center of attention when I'm out and about, but I feel drained by it. Like when I come home, I'm like, I need to now stay in for days. So, and my favorite thing to do is just to lay on the sofa and watch TV.
Yeah, tune out from the world, switch off, pajama
Exactly.
days. I love those days.
Yeah.
Going out to the movies or a night in at home? I think you just answered that.
I think I'm not in at home, but I do love going to the cinema, but that feels like I'm going to go and have like a treat evening. But yeah, I do love just staying at home.
Would you rather never listen to music again or never watch TV again?
Oh, that's such a good question. I think I'd rather have music over TV. I think.
Yeah,
Yeah,
that's my answer. That I feel like you just need it for your soul sometimes.
100%. Like, there's no better feeling when you're just putting on music and you're just blasting, or like driving somewhere. Just
Driving,
blasting. Yeah,
that's my
yeah,
therapy.
literally, literally.
Would you rather it only be summer or only be winter?
Well, do you know what? I think I'm so sick of summer this year. I think I'm like, I miss winter so much. I'm so tired of being so hot and sweaty. Um, but I do think I'd still sit with summer. I'd rather it always be summer.
But I do feel just a bit too hot this year.
It's too hot this year. And it'd be fine if there was like a couple days in between that were not very nice. So you could be like, oh, actually, no, I take it back. But there's been no reminders of what it used to be like.
Or even just a dry heat. It's the humidity. I just can't.
Yeah, which a nice breeze would be lovely.
Yeah. Would you rather go forward in time or backwards in time?
Oh, I think I'd rather go forwards in time.
Would you?
Yeah, I think I'm nosy. So I think I'd be like, I just want to know what's coming. Yeah.
Okay, thank you for answering those. That gets us to know you a bit better. So go back, tell me your story. Tell me when it all began.
I was about to say it's a long story, but you're probably very used to that when it comes to women's health issues. I am interestingly, it kind of began when I was about 14, 15 at school. I started my period. They were quite normal. I remember having a few bad ones and being like, oh, I didn't expect that, but nothing crazy. But I also, around that time, started getting really bad back pain at school. Um, and then one day the back pain just disappeared and I kind of forgot about it. But I also went on the pill around that same time. And so I
Funny
was on,
that.
yeah, it's so strange, so strange. And so I went on the pill. And then when I was 16 years old, I then came off it when I was about 20 when I was at university. And I didn't have a period for over a year. And it was a very stressful point in my life, to be fair, that maybe it was like the stress that would allow it. Maybe it was the pill that just like halted it. So I remember going to the GP, really worried. And I remember giving me blood tests. And when I had the blood test back, I remember ringing the receptionist to be like, oh, should I come in for my results? And they were like, oh, no, you've got PCOS. And I remember being like devastated. Yeah, just the receptionist on the phone, which is crazy.
Oh my goodness.
Yeah, crazy. And I was 21 and I remember feeling like devastated about it. Yeah, like nuts. And I think back then it was obviously when we were on Facebook and no one was really sharing social media. So you very much feel like you are alone. The only way you can feel better is like finding out certain celebrities that maybe had it. And I remember just feeling really like really depressed about it. And I remember going to see the GP and I said, what can I do? And she was like, you just need to go back on the pill. So that was kind of like the only answer. I was like, okay. So then I kind of didn't let myself really think about it for in my 20s. And I remember feeling really ashamed. I remember thinking, oh, I'll probably struggle to get pregnant. And I remember having this active thought being like, I can't tell guys that I'm with because I'm scared that they'll be like, oh, like, which now looking back is crazy because obviously there's so much you can do with PCOS. It's really not the end of the world, but I think I was like very like catastrophizing. So I think my whole 20s, I thought I had PCOS. And then when COVID started, So I was on the pill that whole time. When COVID started, I was like, and it's so interesting because when I heard you speak, you said something so similar. I was like, I'm going to come off the pill. I just want to, let my body work naturally. And I said to myself, I was like, if I don't have a period, I'm not going to worry about my fertility. That's okay. We'll work it out. And I'd read so much about like raw food diets that I was like, if I ever want to have a baby, I'll just go on this raw food diet and then maybe I'll be fine. And so I came off the pill as we started having to isolate. And I got my period back within like 5 weeks. And then every single month I got my period and I was like ecstatic. I thought, I can't believe it. It must have been the stress before. Like I did, like this is fantastic. Like maybe I'm fine now. And then every month, like the periods kind of got worse and the period pain was quite extreme. But I just, I had friends before that told me their period always felt really bad now, but I kind of dismissed it because I'd never really had it. I thought, I can't be that bad. Like, come on. And I thought, are we just like all like playing up to this trope that like, oh, we got bad periods? And I feel so bad for that now. And I just thought, oh, this must just be like a bad period. This must just be what it's like. And again, I was kind of like really loving it because I was so happy my body was working. And I
Yeah.
was like, this is great. And then after like a year, maybe no, it was like about a year of my periods come back, I then started getting back pain. But it was also around the same time I started doing stand up, and I just thought, okay, this is like interesting. What's going on here? And then maybe about like 2 or 3 years in, had chronic back pain all the time. Back pain was so much worse around my period. Um, and then my period pains started becoming so bad that I would be throwing up, not because I felt sick, but because, the pain is so extreme. And I'd never experienced anything like that. I thought, I can't believe a pain can be so bad. I have to throw up as a
Yeah.
release. It
Yeah.
was, it was mental. And I remember like, it'd be like 4 a.m. getting in the bath and then having to drag myself out of the bath, being like, because when your eyes go back in your head, and I
Yeah.
was like, oh, I could drown in here. And it was insane. I've never seen my boyfriend look so scared. And he was like, we've got to go to the hospital. But I was like, I'm not going to the hospital for like a bad period because I just thought, oh, this is fine. I know, like crazy. And I remember just like laying by the toilet and sitting on the toilet thinking, am I giving birth? You hear those stories of women that don't realize they're pregnant. And I thought, am I actually pregnant? Like it was, it was just insane. And
It's that sensation though, isn't it? You almost feel like you want to push.
100%. Yeah, it's like there must be something in me to get out. And it was crazy. And I remember that night laying in bed when the pain had like eased a bit. I'm being like, maybe there's a link between my back pain and periods because I was like, I remember that at school and I was like, oh, it did just disappear overnight. And and then I started reading about endometriosis and it's like almost like sciatica kind of thing, but like almost like a not fake sciatica, but it causes that.
Yeah.
And so I went and saw my GP, and I was like, I think I've got endometriosis. And I'll never forget. He goes, "Okay, Sophie, what do you know about endometriosis then?" And I was like, "Okay." And so I told him everything that I'd learned, and he was like, "Yeah, that's actually right." He's like, "Well, I'll send you to get a scan and an MRI." Which I also knew was not really how you diagnose endometriosis, but I was like, okay, we're on the process. I know they have to check everything else first. So I went and had this scan. In the scan, they were like, you don't have PCOS. It doesn't look like you've ever had PCOS. And I was like, oh, so glad I spent the last 10 years worrying about that. Amazing. And I do know that PCOS is obviously quite hard, well, was quite hard to diagnose. I think now they have more of like who knows. And then I also had an MRI, and the MRI said I had like slight bulging discs. Um, so when I went and saw the GP again, he was like, look, I think based on your scan and MRI being clear, I don't think you have endometriosis. I think this is fine. It's just your hormones or whatever.
You should
I
have
know.
said to the GP, what do you know about endometriosis?
Literally,
First
literally,
rule.
honestly, like crazy, like yeah. Why am I telling you what endometriosis is?
Yeah.
Like insane.
The first
And
rule is a negative scan does not rule it out.
literally,
Oh, it makes
honestly,
me feel sick.
I know and I left being like, oh, I've just made that up and I'm crazy. And then a few months later, I had a really, really bad night and I was so ill. And I remember again, I refused to go to hospital. But also, I think the refusing to go to hospital was like the thought of having to get down these stairs and get in a car in this pain. I was like, there's just no way. I was like, I can't actually move. And I kind of knew I was like, in a few hours it will pass. Like I'm sure it'll be fine. And I think what's so scary is when you're in that pain, no matter, no, it doesn't feel like anything will touch it. I feel like unless I take pain medications just before the pain comes on, like nothing's going to like take it away. But I had a really bad night again, and the next morning, my boyfriend was like, "You need to ring the GP and just tell them what's happened." So I rang the GP, and this time I spoke to a woman. She was amazing, and she was immediately like, "This is not normal. This isn't okay." She was like, "I'm going to refer you immediately," and it was incredible. And it was like the one thing that I've held on to throughout this whole time that I've been like, okay, no, I'm not crazy. Like she's told me this isn't normal. I was so excited to see a specialist because I was like, oh, they're gonna know. They're gonna understand what's gonna go on. I've never been more excited for a hospital appointment. I hate going to hospital. And I remember it was like, I think I was on the wait list for a few months, went and had this appointment, and it was a woman, and I was like, amazing, she's definitely going to listen to me. And I immediately got in there, and she didn't even ask me any questions. She like looked at my notes, and she just turned to me and she goes, Sophie, this is very normal what you're going through. It's just your hormones. And I was like, okay. I was like, but even if it is my hormones, I was like, should I really be throwing up from it because I'm in extreme pain? I was like, surely that's not normal. And if that is normal, that should not be okay. And she just said to me, she goes, you just need to go back on the pill. Now, the
Oh
one thing
God.
do you know what annoys me so much is since reading your book and listening to you talk, it annoys me so much that I'm like, if she'd have just told me the best, even if it is endometriosis, Sophie, the best thing we can do is to go on the pill because by this point I almost felt angry and I was like, no, well, I'm not going to do that. And I want to know what's going on.
And that's what happens. That's the problem.
And I'm so frustrated because if she just said to me, Sophie, like, listen, it might be endometriosis, even if it is, this is what they'll do. And this is and also no one, the problem is like, there's a big, and again, since reading your book, I think there's a huge like miscommunication with the pill because I thought, and what I've seen so much on social media, is that the pill masks symptoms. I thought it meant you don't get the pain, but it's growing inside you. And I was like, I'd rather have the pain and know what's happening. Like I can tolerate it, but what I didn't realize is that it stops it or it slows it down or it holds it. And I think that's been the most frustrating thing about all of this, because if you just hadn't given me that one bit of information, I could have made a better decision.
Yeah. And that's what I said. That's what I say in it because it's like putting people on a pill is the right thing. What's
Yeah,
wrong is the communication and the explanation. And this is why so many women are dismissing the pill because they
yeah,
think it's a fob off. And it's just like, oh my gosh, it just fills me with frustration that,
yeah,
and if you get dismissed so many times, you're going to start just giving up and then
yeah,
normalizing something which is really unhealthy. And there you go. Naturally, we would rather keep in pain so that
yeah,
we're aware of what's going on because we're scared, because we're not trusting what's going on around us. And that's caused
100%.
more damage.
This is it. And like that, it could have all kind of been stopped. And I think there's also this added anxiety of like, well, I came off the pill before and I didn't have a period for over a year. And I was like, I don't want to keep messing with my hormones and my body. And so I just didn't, and I couldn't, because she wouldn't have a proper conversation with me. It was so hard to get any of these answers. And I'm so frustrated at myself for not, well, there wasn't your book at the time. I didn't know. But like, so I feel like I'm so frustrated that I wasn't given that information. I could have made a better decision because I felt quite stubborn and I was like, well, I would like to know if I have endometriosis. And she goes, well, even if they find out, they can't do anything about it. And I was like, okay, well, which is also not really true. I understand what she's saying, but it's like it's not. She was quite like annoyed at me for pushing forward. I think for being wanting to be put on the list. And I still pushed. I was like, well, I'd like to know. And she goes, okay, well, I'll put it in the list. It's a 2-year wait list. And I was like, that's fine. And then she started explaining, well, if they find it, they can do this and this. And I was like, so already you've gone back on yourself. So
Yeah.
it was, but I wish I'd been put on the list and I wish I'd gone on the pill on that very day. Like I wish she'd said, let's go on the pill, also put it on the list, this will help. But that didn't happen. So I go on this wait list. I'm then anxious for a good year thinking, oh my God, have I just made this up in my head? They
Yeah.
obviously don't give you much information about what happens with the operation. You just are like, we're turning up that day. I didn't know if they were going to remove it when they saw it. If they, so then I read loads of things about like ablation's not necessarily the best. And there was no answers. So I had to sit there and wait for like a year. And then before Christmas, I had my appointment booked in. It was like 8th of December. Again, really nervous on the way that I like was putting myself under the knife really for no reason. And then I was in the few weeks before, like maybe 6 weeks before that, I'd been in a lot of pain. Endo belly. I felt like I constantly had endo belly. I it was just particularly, I was on my day 16 of my period. Again, not that abnormal because like every month, or sometimes I'd have months where I was just spotting for like the whole time. Sometimes I wouldn't. So I didn't think that much of it. Like I'd had a period, that my period wasn't as painful as normal. And then I got to the hospital. I was ready to go down to surgery, and the nurse, I had like the anaesthetist come in, the surgeon come in. Even the surgeon came in, and I remember him saying to me, he goes, "So what are your symptoms?" And I purposely listed every single symptom of endometriosis. I was like, I'm going to tell you because I'm so sick of being made to feel like I don't have it. And he goes, "Okay, Sophie," he was like, "just so you know, only 30% of people that have this operation find out have endometriosis. So if we don't find it," which he was like, "we probably won't, we can fit the coil." And even in that moment, then I was like, "Oh, this is time. Like, I'm insane." And also, it's like, I felt really bad because I was like, 30%, that's still quite a lot of people. And when this is really the only way to diagnose, what do you expect? Like, people, there's not really that many other options. I know there's getting more now. So anyway, I sat there still feeling like I can't believe I've done this, thinking, oh, I saw there was this new thing you could do privately, and it's like a test that's not invasive. I thought I should have just done that. And then the nurse came in with the surgeon and the anaesthetist, and she was holding my pot of wee. And they were like, "Sophie, we're not going to be doing surgery today. We've got some great news. You're pregnant." I burst into tears. And also the most embarrassing thing was the anaesthetist had already come in and she was like, "Oh my God, I was hoping it was going to be you." She was like, "I'm a huge fan of your work." Crying, being like, "This is so embarrassing." She's like, they're probably, and then they're panicking because obviously they've been like, "This is great news." And I understand that they probably thought so many women struggle to get pregnant with endometriosis, and I'm here and I'm pregnant. And I'm thinking I'm getting married in 6 months. Like, this is such bad timing. Like, oh my God. And also, I'm like, God, I'm gonna have to wait another 2 years now to try
Oh,
and find out about endometriosis. I was like, what have I done? And I'm really crying. And then I'm like, I'm so confused. Like, how am I pregnant? I'm on day 16 of my period. And obviously, for them, alarm bells are now going. And they're like, "We're going to get you down to the early pregnancy unit." And so this is why I'm writing a show about it at the moment, because so many funny things happen. Like, so many outrageous things happen. Like, it was like a TV show. And I suppose you're probably used to that from working in hospitals. Like, every day feels like a TV show because it was just nuts.
yeah.
It was, yeah, just crazy. And I was walking down to early pregnancy unit. Even the nurse was trying to convince. She was like, yeah, because I was like, "This is just really bad timing." And I was like, "I'm getting married, and I've got my dress already." And she was like, "You could get a nice dressing." And I was like, "Oh God." She's like, "Maybe it's God's plan." And I thought, what is going on in this place? And I rang John, and John got to the hospital, and then they immediately like kind of fast tracked me, and I had a scan, and then in the scan, they were like, "You're having an ectopic pregnancy." And I was also confused because I was like, "Oh, I took the morning after pill before this, right?" And they were like, "That often can cause ectopic pregnancies." So then I was there feeling really bad, and I was like, "Oh my God, like I can't believe I've done this to myself." And then they gave me like this room to like lie down in. I was obviously like a mess, and like I was just like, "What is going on?"
It's like
Feeling
an
like,
emotional roller coaster from mentally getting yourself ready for surgery,
yeah,
told you're pregnant,
yeah.
how to process that to it's an ectopic.
Literally, because I would have wanted to keep the baby as well, and also I was just like, what, like, because I knew as well, I was always so fearful that I wouldn't be able to have a baby, that I was like, I can't now have an abortion when I've my whole life thought this is going to be really hard for me. So then, or in a weird way, I was like, well, at least it's taken out of my hands. I didn't realize that they would then. I remember John making this comment, being like, well, I was like, they're not going to do that. I was like, because I don't know anything about ectopics. I was like, they would never do that. And I was like, if they were going to do that, I think I would have heard them. But I'd obviously blacked out throughout this whole thing and just couldn't really hear anything. So then when they came in and told me they were going to remove it, I was just like devastated. And I was like, oh my God, like what's, like, I just thought this is just nuts. And I then had the surgery the next morning because I'd had a couple of biscuits by this point. And they were like, "You need to stop eating." I was like, right, okay. One of them, like, "You're pregnant, you need to eat." Next one, they're like, "Stop eating." I was like, okay. I was like fasting for another 6 hours. I was like, I'm going to lose my mind. And when I had the surgery, again, there was so, like the anaesthetist was also a stand-up comedian. The other woman did improv, and I was like, I don't know what's going on in this hospital, but everyone is nuts. Like, one of the nurses came in, she was like, "I printed all the information on that topics on stickers by accident." She was like, "By the way, I love your TikToks," and then run out. And I was like, it was just honestly, they were all, I was like, I thought in hospital you had to pretend that you didn't know someone if you did. I thought it was like a whole like ending. It would, to be fair, the way I was looked after, and as soon as I was pregnant, really, the way I was looked after was very different. Like the treatment, and even John noticed it. And it's so interesting to me that I think even when you're going for these appointments, like if I'd have been going for these appointments initially and saying, look, I'm trying to get pregnant and I can't, I think the treatment and care would have been a lot different to if I feel I'm just in pain. Like I think it is really interesting.
Hmm.
Um, and then when I had the surgery, essentially they had to remove my left fallopian tube because it was all stuck to another one of my organs from scar tissue and from endometriosis. Crazy. And then there was also, they were like, we saw quite a lot of endometriosis around your pelvis. And what I was really lucky with was the nurse who initially looked after me was an endo nurse. And she'd asked the surgeons, that she was like, look, she's come in for this. When you're doing the operation, could you have a look and just see if there's endometriosis, just so she doesn't have to come back, which was amazing.
Yeah.
And there was also meant to be an endo specialist doing it, but because I'd had a biscuit, I had to get a different one because he was like, if I'm there, I'll remove it for you. So that, but at least they were like, they knew, they saw it, they got all the pictures and stuff. So that was good. But afterwards, the appointments afterwards of what, and that's why I'm so grateful for your book, because the appointments afterwards, I felt like I've gone more insane. Like the first time I went back, I asked for a pill, and she gave me a pill that probably was not the best. She didn't give me like a high progesterone one, which I think is what they initially try you on. And then I also asked her, I
It
was like, oh,
was an estrogen only pill because that would be like
to be fair, I think it might have been combined. It might, I don't actually, it was one for good for acne, and I thought I'd actually rather have acne and get rid of endometriosis. And then I said to her, I was like, I'm thinking about getting my embryos frozen because I just wanted to have a conversation of like, is that a good idea? Like, I don't know how any of this works. And she was like, no, you don't need to do that. She was like, you've got pregnant, you'll be fine. And I was like, oh. I was like, I did get pregnant, but I did lose the baby and I've lost the fallopian tube. And, if I don't want to have a baby for the next few years, like, what's to stop it from happening again? Like, I just would like to know. And she was like, no, no, you'll be fine. And then she was like, if you'd like, I can send you to get your fertility checked. And I was like, yeah, you could check I'm not in psychosis too. That would be amazing. Because again, maybe she was like, that could make it worse, but she didn't say any of that to me. She was just like, no, no, you'll be fine. You got pregnant once, you'll be fine. And like bizarre. I'm 33 as well, that I thought, if I don't have a baby for 2 or 3 years, like, uh, maybe I should have like,
condition, which is like one of the biggest causes of infertility.
literally telling me you'll be fine. So I left. I then went and had to have this MRI that they put liquid in you. And then I went and saw the doctor after that, a different doctor this time, and he goes, okay, Sophie, so for some reason they put the liquid, didn't quite go in right. We don't know where it is. Great. It's like fantastic. And he's like, but I spoke to the person that reads MRIs, and she said, you don't have endometriosis. And I was like, oh my God.
No, no, no.
He's like, you don't have it. And I was like, I told him everything happened. And I was like, obviously hadn't read my notes. And I was like, no, no, I was like, I do have it. And he was like, no, no. He was like, you don't. He was like, it's probably just your hormones. And then he then goes, but then I've seen your fertility results and they're not good. And I was like, great, amazing. And he's like, so if you want to have a baby, you need to have a baby right now. And I was like, okay. And I was like, I really can't have a baby right now. I can't I was like, I live in a tiny one-bed flat. I've got things, I need to get my career, my financial situation. I've got so many things that I need to sort right now before I can have a baby. And then he was like, oh, you should definitely freeze your eggs. And I was like, oh, this is what I've been trying to ask. You're like, I'm going to lose my mind. And then he started reading through my notes and then obviously got the pictures of me. He's like, oh, that's so weird.
Oh,
He's
you
like,
do.
I've never seen that before. And then he was like, yeah, look, it says here that you've got endometriosis. I was like, yeah, I definitely trust this.
Oh my God.
And you're like, I'm going to lose my mind in this place. Yeah, so that was my last appointment with the
Why do
NHS.
you write a show for it about it?
Oh, the show writes itself. The show writes itself. And the problem is, the show is so unbelievable. I'm like, every single thing in the show is true. It's mental. So now I've got Bupa. And I had an MRI on Bupa the other day. But again, the wait lists for Bupa is just crazy. Like I'm waiting like 8 weeks now until my follow-up. And it's only by Zoom, and then they mess you around a lot, but I'm like, I'll take it. Give me the scraps. Like, and you're like, I just want someone, because what I was nervous for after like listening to you about your journey with IVF is, I would like to freeze my embryos, but am I making it worse by pumping my bodies with hormones? Which I asked this specialist, like a world-renowned specialist, and he was like, no, it's fine. And I thought, I don't believe you. So I don't know what to do.
so difficult, and this is why so many women just lose
Yeah,
trust, because it's like no two specialists are saying the same thing. It's just like, how difficult is it for them all to just read the guidelines? If they're in a position of advising women, they should be up to date with their knowledge and know what they're talking about. It's literally damaging people's lives. It's like I had such a similar experience of being told go and get IVF. Well,
yeah,
that finished me off.
this is it.
Pregnancy that I was never going to be able to carry. And when I finally saw the one of like the holy grails of like those
Yeah,
past surgeons who was like put his head in his hands, being like, "No, IVF was not right for you." In that time, done in that way, and that's the key bit. It's like,
mm,
yes, there is a role for fertility treatment, but you've got to do it in a certain way, in a certain, and this is why I keep saying fertility has to be done with gynae, hand in hand with two
yeah,
specialists who know what they're talking about, making a proper plan. It's not just a one trick fits all kind of scenario.
yeah.
So, have you seen a endometriosis gynae specialist?
Yeah, so since that appointment, I had a Zoom Bupa call. That was another thing. There wasn't that many on Bupa that were endometriosis specialists. And so I didn't realize, like, I just assumed when I was going to see a specialist on the NHS, they were an endometriosis specialist. But of course, they're like the wider picture, so they don't necessarily know that much about it. And I think that's what's been so difficult. It's like, I don't know what the best, like, even I spoke to the specialist and I said to him, I was like, okay, well, I've been off the pill for this because I'm meant to be starting the process of embryo freezing end of this month. So being off the pill will be almost 3 months, which I'm very anxious about now being off it. But I didn't love being on Dynagest. And I said to him, I was like, oh, well, I need to go back on the pill. What one should I go on? He was like, go on the one that used to work well for you. And I thought, I just would like to know, I'd like a bit more than that because I don't know if that one did work well for me. And I'm just like, I feel like I'm like, I just don't know really know what to do. And like, it feels like, okay, he might be an amazing surgeon. He might be amazing at spotting it and doing this, but it's like, how, it's so hard to get like an answer for like the right, for everything. And like, like, it made me nervous when he said about, when I asked him about the embryo freezing, I was like, but surely that's pumping my body with like estrogen or like all these hormones that maybe that's not going to be good for it. He's like, there's actually no, he said there's like actually no science to show that it does that. And I'm like, I don't know about that. I don't know if that's necessarily a good thing though. So when you're just like you said, it's so hard to trust anyone and it's so hard to trust. And I know these people are specialists and experts and stuff, but I don't know if anyone really knows what they're talking about of endometriosis.
This is the problem, and this is why people are so confused, because they assume that every gynecologist knows about endometriosis, but
Yeah,
unless they're an endometriosis specialist,
yeah,
but anyone with suspected or even confirmed endometriosis, they're only eligible to see the endo specialist if they have stage 3 or stage 4 disease.
oh,
Just not enough in
yeah,
in the country to meet the demand. So it's only if you've got
yeah,
advanced disease
that's crazy.
get referred to see an endo specialist. So many women get confused, like, what do you mean you're not an endo specialist? I'm got endo. Why are you treating me? And we're still not regulating or even auditing what is being said to these
Yeah,
patients. And if you don't know any better, you just trust what they say. I mean, this is why
yeah,
I do what I do, because I was a doctor being
yeah,
told by a colleague, this is what you need to do, and it was wrong.
that's
And I was like,
crazy.
if I, as a doctor, got misled and got, what hope do people have? And I still see, the wrong information being put out there. And you're like, how difficult is it to just make sure that everyone's following the guidelines? Because this is the thing. There isn't no hope,
Yeah,
treatment options, not to cure, but to manage things.
yeah,
There are pathways and guidelines so that your fertility can be managed properly, you can delay that spread, delay the damage, avoid the worst case scenario.
yeah.
Why are they not?
This is it. And this is the thing, and like also just acknowledging it, like because I'd had so many people tell me I was fine, like with that ectopic, I was like, thank God I was in hospital because I would never have gone to hospital with that pain. Pain was nowhere near as bad. And like also, if they'd have given me the right information, that would never have happened. Like we'd have never got to this point. And that's what's so frustrating, I think. Like, there's so many things where, like, if I'd have just been given the right information or listened to or acknowledged and be like, yeah, maybe it is that, but we can do other things. It's just so frustrating, and it's just like quite scary to
It,
just,
because you just think it's a wonder that more accidents don't happen and like severe complications. Like
yeah.
you could have ruptured, and that
Oh,
is
exactly.
life threatening.
Yeah.
But again, that could have been avoided if you'd have been advised why you should go on the pill when you first started
Yeah.
that process. And it,
100%. It's so
you've
frustrating.
been given a diagnosis. Have you actually had a sit down conversation where someone's given you explanation, counselling, told you what the longer term picture looks like, looks at your notes, and has gone, right, this is the short term plan and this is the long term plan?
Not once. Not once. It's crazy.
So, the good medical practice, the basic standard is that, and
Yeah.
it's just not happening.
Yeah. It was just like, what? It was almost like, why are you here? Like, and I was like, well, I've just had gone through this kind of crazy thing. I'd love to have like to talk next steps. And it was very, even I had to ask to go on the pill for her. She wasn't like, just go on the pill. And I was like, I think I've been told now to go on the pill. Yeah, no, literally nothing. Absolutely nothing. It is crazy. And then the second time he was like, you don't have it. And then afterwards he was like, right, you just get your eggs frozen. And it was just like, it is crazy. Do
And
you know
then
what's so funny? Because I thought all I kind of wanted was a diagnosis, and I think probably so many women that have it. I was like, I just want to be told I have it because then at least I'll know what's going on. And it's been so much worse since finding out. I was like, this is like the anxiety is just crazy because it's like, oh, I just every day is like, I don't know what's going on. Like, it is mad.
you shouldn't have to be a warrior to like
Yeah,
having to figure this out for yourself and having that lack of trust. I get anxiety if I turn up to my gynae appointments and it's not my surgeon. Soon as they say it's someone different, I'm like, oh god, no. I'm like
no, yeah,
panic thinking, are they going to talk crap at me? Are they going to gaslight me? Are they going to
yeah,
listen? Are they going to tell me something rogue? And you shouldn't have that. Like,
no.
in a situation where people across the country are not trusting doctors, and it's not based on nothing. Like, we know this is a problem.
Yeah, and it's interesting to me that there's like doesn't seem to be much self-awareness from them in these appointments. So it's like this is a huge like narrative right now. Like obviously it's all I see on social media. I know that's my algorithm, but even like the general consensus is the way women are treated when they go to hospital is very like they're dismissed, they're ignored. Like not once have I feel like I've been listened to. And it's so interesting that they can't kind of put that. The one thing I liked about when I had this private appointment was he goes, okay, you're just going to tell me and I'm going to listen. And it was like the first time I was like, oh, amazing, like wow. And that was really nice and that was more reassuring. And even like when he looked at my pictures of my insides, he immediately was like, oh yeah, there's endometriosis, there's endometriosis. When I saw the specialist on the NHS, he was like, that scar tissue. He was like, I don't know if it's endometriosis. And I thought, I know it's really hard to read, but I thought even that's just not, there's no reassurance. You don't really know what is going on. It's just, yeah, and it must be especially hard for you because you do probably know more than all of them. And it's going to have these appointments, like, well, I can just tell myself this.
Do you know what stage you have?
No idea. No idea. What was all I was told? The only time really been told, apart from with I now had another special MRI with Bupa, so hopefully that will tell them. But when I had the operation, they came in and they said some of your other organs are fusing. You've got a lot around your pelvis. They made it sound like there was a lot.
That sounds like
Um,
stage 3, stage 4.
yeah, but then since then, I think because it didn't show up on that special MRI, I think they were like, oh, it's not that bad. So we'll see with this next MRI. So because I would ideally like to have it cut out if it is that, and then go on the pill and just try and just so when I do try and get pregnant, it's not as hostile as it can be.
And that's the thing, because I'd had 6 miscarriages, and it
That's
was only after like 3 or 4 that I finally got the diagnosis. And even then, I had no idea that I had it hadn't occurred to me or
crazy.
anything. And when I was then told to have IVF, which I inevitably miscarried and made it so much worse.
Yeah,
And it was only then when I finally saw a specialist who then said, right, this is what we need to do. We need to like put you into menopause, let your system calm down, do
yeah,
surgery, clear it out. By that point, it was so bad. He said, "You look, chances are you're going to need a hysterectomy because you've just got advanced disease, bowel damage, I think we just need to take it out. And at that point, I was like, yeah, I'm done. I can't.
Yeah, yeah.
I felt pregnant whilst waiting for my hysterectomy.
That's crazy.
And it's because I'd had
A
6 months
rest.
of menopause, the clearance surgery,
Yeah,
calmed down, everything, the tubes were untangled,
yeah,
the proper treatment that puts you in the best possible position.
yeah,
It's a complicated pregnancy, but I have my rainbow baby, and it's like
yeah.
proof that if you do it right,
It can
the right
happen.
treatment, surprise, surprise, it works.
Yeah.
And it's just like, why is this not standard? Why is this not everywhere? It just frustrates me.
It's yeah. Like I think your book will save so many people. Like I've told so many people about it, especially people that are like trying to have a baby or having fertility issues. It's like before you make any crazy
Yeah.
decisions, just read this book really quickly. Read this
I
book.
wish it cost me £12,000. It
Yeah.
cost me another miscarriage,
And
and
the emotional toll, it's more like it's just
it's not
crazy.
an easy process. It's not.
No.
Those hormones, and especially if you're neurodiverse, which I am,
Yeah.
the impact on your emotions and like your sense of it throws you off, and relationship impacts, it affects everything.
Yeah, yeah. Well, this is it. I remember when you were saying about, you've had so many different personalities depending on like what pill you've been on, and it's like I feel the exact same, and that's why I'm so like conscious of like what one do I go on next? Because I really just don't. I just don't want. I just want to be mentally sane, and I think that was what was why I was also so anti going back on the pill because I have very like I think I probably have PMDD symptoms for
Yeah.
sure. That I was like, but in a weird way, I was like, oh, it's nice to know this is who I am and this is how I feel. But actually, after having a few months on Dynagest, mentally, I was a lot better, and I was like, oh, that was lovely. Actually, that was nice to not feel insane all the time.
That's why I love menopause, and that's why I'm not on HRT, because I'm like, I have the same mood every
Yeah,
single
I know.
week. I
Yeah,
know where I am. I know who I am. You know,
yeah,
and this is why, postnatal depression and the different, all those hormones have a huge impact. And unless people are told, which hormone you're more sensitive to, this is
yeah,
why women go, no, no, I'm not touching the pill. It doesn't work for me. And it's like,
yeah.
it's
One of them will.
one of
Yeah.
them will, or it's that one, or it's that type of progesterone, or it's that dose. And um,
Yeah, it's and also since because I know in your book you have like that table and you were talking about it. It's since because I've been trying to Google so much about like what's the best type of one. There's not much information out there. Like there's not information to go like you were saying about it's like different sensitivities. It might be like when it changes in the month, and I'm like, oh, it's so hard to actually get a good idea on like what to do or yeah, it's just not enough. There's so much information. There's so much wrong information or so much confusing information. That's like where I just need clear answers.
and this is why I've started doing, health navigator work, because
Yeah,
sometimes you don't need necessarily a doctor's appointment. You need someone who can go, right, where are you in your journey? I know what I'm talking about. These are the next steps. Let's look at what your options are, and to
yeah,
help guide you on that next step, because I think that's what's needed more and more, because the GP used to do that, but the GP doesn't do that anymore.
yeah. That's exactly, no, I didn't realize you did that as well. And I think that's exactly that's all we really need. We just need
Yeah.
someone to be like, this is what you need to do
Yeah.
instead of us being here and being like, especially if you're on the NHS, like, it's like, okay, we'll see you in 6 months. And it's like, well, you're going to tell me the same thing again in 6 months. Like, no, you're not giving me any information. So I think it's so amazing that you're doing that. Like, just someone to be like, it's almost like having like a life coach, but
Yeah.
actually
Like a
for your
doula.
body.
I say it's like being a doula, but for health.
Yeah,
Like,
yeah,
have that person that comes with you on your journey, holds your hand, explains what the results mean, explains what your options are, helps you navigate, and it's literally helping you navigate your journey
yeah,
with someone who knows what they're talking about. And
yeah,
it's becoming more and more of a thing of, professionals kind of not being your doctor. I'm not here to treat or diagnose. I'm here to guide you.
yeah.
This is what the GP used to do, but it doesn't happen anymore. But people still need help navigating, where to go next.
Yeah, 100%. It's just, and even like there's so much, I think there's so much, I know you said about online, there's so much. When I first came out of hospital, my boyfriend was like, you need to stop going on reading about it because I was just finding myself getting more anxious. And there's almost like a kind of competitiveness of it as well, of like people. And it's like, I found myself feeling so like horrible and just like more stressed. And I was like, oh my God, I can't deal with this.
I
So
literally
it's
just
like,
came off social media for like a month because that intensity of it's almost a competition of who's got the worst story,
exactly.
who's got the bit worse disease, scaremongering that it's inevitable that if you have endo, you're going to need a hysterectomy, you're going to get bowel damage, and it's like, no, we need to encourage hope and support and realize that
Yeah,
actually it doesn't have to be like that. Incurable
yeah.
doesn't mean there are no options.
And I don't know if you've noticed with this, but the one thing I've really noticed by a lot of people talking about endometriosis is a very,
Yep.
and that's what when I read your book, like that was the first time I'd heard that it was like actually this is a good thing. And I was like, oh, like, oh, and even I read the comments and people be like, it just masks it. And I think
You're,
I want to scream now, and I'm being like, guys, like, it doesn't. And it's
feel my pain. You feel my pain now.
yeah, I really do.
Get abuse on TikTok.
Do
Yeah,
you?
I have to be careful what I post on TikTok because I get so much abuse for trying to explain why the pill works and why it's a good thing. The amount of really awful comments I've had and
Really?
attacks and people trying to argue with me, and I'm like,
I
I'm not just a, I'm a doctor. Like I'm a
yeah, yeah, I know
specialist.
what
I
I'm
know
talking
what I'm
about.
talking about.
Yeah,
That's what's been really concerning is that people just don't listen. They don't believe it.
we don't believe it. Yeah, and I wonder if it's because women have been for so long told go on the pill, no answers, that we just see it as like a fob off, and we're like, no, we will get our answers, and it's like, because that was me, and now I'm like, oh,
And
I
that
wish
was me.
I was on it.
And
Yeah,
that is literally what the turning point for me was all those years ago. I had another appointment where I was told, well, you're not taking your HRT and just take more pain relief. And I wanted to scream.
yeah,
And that's when I went, why are they saying this? Why,
mm,
there must be a reason why they keep saying it. And that's when I did the research and went, oh,
yeah,
light bulb moment. Like, oh, there's a scientific reason why
yeah,
I need to take pain relief, why the pill is important. And
yeah,
that's when I was like, why are we not explaining this? That was literally the premise of why I wrote the book, because I was like, why are we not explaining this to women? Because then
yeah.
they might actually, if you'd have said that to me when I was 20, I would never have come off the pill.
Same here, same here. Like I just, or like as soon as I start getting back, I'd be like, right back on the pill. Like I wish more than anything.
I would have taken pain relief.
Yeah,
But like you, I
yeah,
was like, no, I want to keep in tune with my body. I want to know what's going on. So I suffered because I thought that the pain relief was masking it when it's like, no, you need to mask it. You need to switch those pain receptors off because they're really
yeah.
like, please tell us this. So
Literally, it's
suffering that we don't need to.
it's so frustrating. It's just like there needs to. The hard thing is getting the information out to everyone in like a way that people can trust it. And like with social media, obviously it's a great medium, but like there is so much misinformation, like you said, and there is so much like, especially I think when we're all trying to like fix ourselves now, and that's when we need people like you that are going to guide you and be like, this is what you need to be doing, okay?
As long as I'm not
But
being like
yeah.
screamed out on TikTok. But tell me, before we kind of wrap up, tell me because you're spreading the word, you're spreading your story in a very
Yeah,
different way, and it's brilliant. You using humor to share your story, so just talk
yeah.
about the show.
It's the only way I really know how to deal with like any traumatic events is like, right, like, when I was in hospital, I was like, John, write this down, like all these funny things. And I was like, this is going to be a show. I wasn't going to do another show this year. I was going to have a bit of a break, but then this happened. So I'm doing a show called A Period Drama, and I'm taking up to the Fringe in a few weeks' time. And it's essentially the story I've just told you, but I've made it very funny. I like to think. And then I'm trying to just like get educate in that way and trying to um, just I don't know, make women feel less alone. I've got had a few friends that have had miscarriages, and the one thing they say to me is like, I just feel like I'm the only person in the world that's going through this, and it's a bit frustrating because I want to be like, so many women go through it, but people don't talk about it, and people keep it very themselves. And I do think that's a good thing about social media. I think back in the day when found out I had PCOS, I didn't tell anyone. I felt like it was just happening to me. Whereas now, obviously, social media does reward vulnerability. However, I know there's obviously like a line. There's a line, but I think yeah, I want to share that story. I find it my way of like my therapy. Really, it's just like talking about it, making jokes about it. I talk about your book in it. I've actually had quite a few people off the back ask me what the book's called. which is great because I just think like I think for people, especially women, when you're watching that show, it probably can be quite triggering if you're going through something like that, or you're thinking, oh, I've got something a bit funny. I can imagine you're sat there feeling a little bit anxious. That is like, oh, it doesn't get better right now, but here's a book that can give you some answers.
Sponsored by Dr.
Literally, yeah. I do say in the show, I say, look, I can't get you a discount code for the book, but I can sign it for you.
I'll have to speak to the publisher, see if we can get you a discount code.
Do you know what? Well, see if the sales go up in Edinburgh. But yeah, I just want everyone to read it. Really, I just think if you're a woman, read the book.
And I think that's it. It's refreshing that you're putting this humor, bringing humor to it to make these difficult conversations more palatable and kind of easier to talk about. And then the men listening as well, being like,
Yeah,
oh my gosh, actually.
yeah,
But then to kind of end with that positivity of, here is a way, here is some information that
yeah,
is reliable, that you can trust, because there is hope. We need to stop having this conversation that it's this doom and gloom.
yeah.
The fact that you're bringing humor to the topic and also signposting people to, some reliable information. Thank you for that. I do
Oh
appreciate it.
no,
Anyone
I'm so
listening,
very passionate about
please
people reading this
not
book.
being paid for this.
No, I'm like, guys, not sponsored, not
Yes.
sponsored. I just think it was like I'm a really slow reader, and I read it within like 2 days, and I think I just was like, oh my God, like this is, and also the way you tell the story, way you explain it is very simple to understand, and I think that's like the key, isn't it? Because it's such a confusing topic, and it's so. I find that when I'm on stage talking about it, I'm like, this is. I think this must be confusing for you guys because I'm confused. So it is like it's amazing that you managed to make it so like simple and break everything down, which I think is so useful.
Thank you. Did you laugh when you read the PCOS chapter then, being like, how much went wrong for that with for you?
Literally, you're like, I just meant to also just like, I can't believe I spent 10 years being so upset about something that I didn't even have. And by the time I got told I didn't have it, I was like, I don't even care anymore. I wish I had PCOS now. Just
Oh,
mental. But I'm sure next time I go, they're like, you've got PCOS actually.
well, are there still tickets or is it sold out?
Still tickets for Edinburgh. Yeah, still tickets. Get your tickets. Normally it sells when it's up there. Well, I hope. But yeah, sales so far have been good. But yeah, I'm excited to go back, and I love this show. I feel very like, passionate about it. So yeah, I hope people enjoy it. I hope if any husbands or boyfriends get dragged along, they can find the fun in it. They can learn something. But yeah, it's really for the girlies.
Well, if you're listening, you're watching, I'll put a link as well on my stories, and so make sure you go and see it. Sophie is a brilliant comedian. This is such a wonderful show, and I'm gonna try and see if I can get a babysitter and like sneak off to Edinburgh from.
Oh yeah, do you know what? If not, I'm going to tour it. So I'm actually doing it in Norwich. I'm doing it in Norwich. That's my only date I've got. I've got a friend that's opening a comedy
When?
place there in the bowl. You know the bowling alley, the bowling thing. I think it's in October. I'll send you the day and I'll sort you tickets. Yeah,
Oh my god, that would be amazing. Oh, that would be
yeah.
brilliant. Oh
So
yes,
no sneaking off. You're fine. Yeah,
yes,
yeah.
brilliant. Okay, that's perfect. Oh well, thank you so much, Sophie. You've been lovely to talk to as a guest.
It's been a dream. Thank you so much. Yeah, I've loved it.